How's it? It's TK from Big Island Thieves Media. I'm here with Elena Cabatu, and we're just trying to get an idea of what's going on at Hilo Hospital and the procedures that we're taking. Right now we're in the testing center, and she's just going to give you guys a quick little go-through of when you come, so you know where to go if you're coming to get tested, and what you guys need as far as credentials to get tested. So what are some of the things that they need before they come to get tested?
So the process with getting your COVID-19 testing requires that you get screened by your primary care provider, whether it's a doctor or a nurse practitioner, and they will either screen you over the phone or telehealth. They'll determine how sick you are, signs and symptoms, all of that, that rolls up into the need to get tested.
What is the process that they do to swab? Is it just like a nice little oral swab, or is it something a little bit more fun?
People who come to Hilo Medical Center for their test will get swabbed once. And so it's quite exciting.
Yes.
You get one swab, two nostrils, that's what we say. So one swab goes up your nose and pretty much hits the back of your brain, and then the same one will go up the other nostril and hit the other part of your brain, and then they'll put it in the test kit and then send it off.
And all this is done whether it's still in the car?
Oh yeah, they'll be in the car. So yeah, we're standing in the testing site.
We're hearing from Hilo's own Kai Kahele when he came to check out the testing center. He said that at present, we're not even sending it to Oahu, or we don't have a center here. It's going to Texas. Is there any truth to that?
Labs on Oahu are ramping up to try to do in-state testing, but we're just going to have to wait and see what happens, and just try to cheer them on as best as we can, because it doesn't do any good to just say, oh, they should be faster. Well, they are. We know that they're working faster, and the reality is, at least we have these tests that we can send out to the mainland, and we will get results. We just need people to take on personal responsibility and take care of themselves.
Following the swab, they leave the test with you guys, and it goes off to wherever's to get tested. Right now it's 5 to 6 days. How do they find out what their results are for their test?
The results go back to the provider. The provider will call the patient, and that's how they'll find out the results. We're just the collector of the samples.
Do you guys have an ample supply of test kits here? Because, we want to just kill some of the rumors.
Sure.
They're saying that there's a shortage. Some people don't even think we have any. Do we have an ample supply right now?
We do have an ample supply of test kits. We have been working with clinical labs to make sure that they have supply. I know they've been working with their suppliers and manufacturers. There's
a lot of people here on the island who, especially with people that's going to be out of work soon, and all kinds of stuff. We're wondering, what does someone do if they don't have medical at this time and they feel like they want to get tested? Yeah.
So I really want to get this right. So let me just make sure I have it. So our friends at Big Island Kokua Services Partnership and MedQuest, they dropped off a flyer to me, and I've been sharing it on our social media platform. I'll send it to you so you can share it too. It says here, if you still don't have health insurance, you may qualify for MedQuest during their 2020 special enrollment period. So this is loss of employer health coverage. If you just got married or had a baby, just moved to Hawaii, had a change in household income, and recently released from incarceration. In a health crisis like this, the best thing you can do is get covered with some sort of health insurance, because that's something that everyone can be proactive in. The other thing is, once you get that health insurance, it opens up access to care. So we are also encouraging people to establish care with a primary care provider. Hilo Medical Center and the East Hawaii region, we're opening up primary care clinics throughout the region, actually. We have primary care clinics at Ka'u Hospital. It's the rural health clinic there. Puna Community Medical Center. They actually started screening and testing today. We have the East Hawaii Health Clinic at 75 Pu'uhonu Place, and they do primary care there. We also have the residency program up here, which will soon be called the East Hawaii Health Clinic at 1190 Waianui Avenue.
What are some of the things that people have extras of that they can donate to the hospital for the workers? And what are, one of the things like we had talked about earlier is a lot of people have been sewing these masks.
Yeah.
What are the benefits, and also what are the negatives of it?
Right. People wanting to sew masks for our hospital employees it's been overwhelming. It's been very exciting. It's been heartwarming. We can't use them for patient care, but we can. We are seeing our nurses use them for walking even around the hospital, because you know what? if that's going to help them feel confident about them walking around our hospital, then we want them to feel confident. We want them to feel secure. But of course, we are telling them if you go into patient care area, you got to use the medical grade mask. The truth of the matter is, what we really need is N95s and surgical masks.
So Elena, is there anything that you want to share with the Big Island community about guidelines or anything we should follow? Like, what is the most important thing, and to deal with this crisis that we have at hand right now with the coronavirus?
Right. The longer we can prolong this disease from happening, the more we can put in place our emergency management plan and make sure we get all the supplies we need that are stuck in the supply chain right now. And so we really need people to shelter in place, figure out what their plans are for their ohana. People should be reviewing the information that's been put out there by the Department of Health, especially, because that's information that's localized for our state. There's one thing that we have time to do right now. It's to review the information that's out there.
To be prepared.
Be prepared.
All right, so Auntie Hano Hano, thank you guys for adding that service in for all our people who don't have the medical insurance. A shout out to everybody out here that's working, the medical staff that's been putting in the hours and setting up things and making the plans. My two homeboys behind the camera, and to everybody out on Big Island Thieves, care for it, you're gonna go viral.